Hi, Dr. Shevers. How are you today?
Good. How are you this morning?
Good. Are you ready for another conversation?
Yeah.
Okay. I'm hoping that you have somebody in mind that you saw this week. This is a good, exciting example of how chiropractic care can really resolve a lot of problems that medical care doesn't.
Yeah, we had a really quite an interesting case with a young lady this week. She'd been in a car accident about a month ago and had some neck pain from it, but nothing too severe. She'd been to the doctors and taken some ibuprofen, and it seemed to have gone away. And then she went to bed, having just done her regular work, and woke up the next morning, and her entire left arm had swollen up, including her fingers, which she almost couldn't move them. They'd swollen so much.
Wow, and that was almost overnight?
It was just overnight.
Just overnight, okay.
I mean, there was nothing. She actually has a fairly physical job as she's a nurse, and had been lifting people the day before and had come home from work and had not noticed anything when she went to bed.
Okay.
So she got up in the morning and obviously went immediately to the ER, and they ran a bunch of tests there and did an X-ray and really couldn't see anything or tell what was going on. She's not diabetic, so it had nothing to do with that. It didn't appear to be a spider bite or anything like that, and the MD decided that the next thing to do was to check, to have an MRI done and just see if anything else was going on. But they couldn't get the MRI scheduled till the next day. Actually, I think it was 2 days later. And the doctor had said, well, it could be just a pinched nerve or something. Maybe you should go see your chiropractor.
Wow.
So she came in to see us that afternoon, and we looked at her, and the right arm around the forearm was 2 inches larger in diameter than the right arm, and we felt around in her neck, and it was very tender. So we felt that it was probably something in her neck or upper thoracic spine that was pinching down on the brachial plexus, which is the bundle of nerves, arteries, and veins that goes from your neck down and does everything, controls everything in your arm. And we worked on that and adjusted it, and then we got out the cold laser, and we cold lasered the arm for inflammation, and we used kinesio tape to tape up the arm to support the venous structure so that it would drain. And we decided that we'd see how it went in the morning until the next morning. And she came in the next morning, and the arm had already shrunk from 2 inches greater to half an inch greater. And
wow.
So we canceled the MRI and adjusted her again and used the cold laser again. And then actually by this morning it was completely back to normal, and the only thing she really had was still a bit of neck pain that we're going to work on this week and next week, but a very quick turnaround from an injury that had
wow.
in all likelihood occurred a month ago.
Wow, and I was just thinking as you were talking, this is a great example of when people have an accident, and even if they're not feeling anything, that there can be there can and quite often are problems later.
Yeah, it really is. It is 100% one of those cases which, if you're in an accident, do not sign off on any medical release until a couple of months after the accident to make sure that, nothing comes up. Because, yes, sometimes you can get out of the car and the adrenaline and everything, you don't even notice that you've been hurt, and it takes time for the injury to come out.
Yeah. Well, it was fortunate for her. I mean, not fortunate that she had to go through this, but in a way that something did come up so soon so that she was able to handle it now, as opposed to waiting like that one gentleman you told me about was years or something, and now he really can't do anything about the problem because it's been so many years and you're not able to, make it right.
Yeah, it is. I mean, it's actually great for her that we got the problem dealt with when it was just there was a very obvious symptom that, indicated there was a problem, so the problem could be dealt with immediately rather than having sat there for, a year or 2 years before the symptoms start showing, and it was just too late to do anything.
Right. Well, you mentioned, let's see, cold laser and the kinesio tape. Can you just briefly tell us what those two things are for any of us that don't know?
Yeah, the kinesio tape, it's used for several things. You can actually use it to support joints. You can use it to support muscles. It can also be used, if applied in a different way. What it does is it lifts the skin up and opens all sorts of extra space for inflammation to drain away. So you can apply it in such a fashion that it really helps eliminate swelling. And if you've got a big bruise and you apply it, you can lift everything up to get the bruising to go away much faster.
Wow.
It's actually really a great product.
Yeah. I mean, I knew what it was, but I didn't know all of that. Thank you for sharing that. What about the cold laser?
The cold laser, it gets the cells turning over faster, and as the cells turn over faster, it gets everything to flush out so that you can help speed up the body's ability to eliminate the inflammation.
So what's the actual equipment or tool that is used for that?
We have two kinds of cold laser here. We have one that is just a cold laser, and that just does the kind of the inflammation, or you can use it at different frequencies to treat muscle spasms. You can use it to treat some pain. Really, it's great for inflammation control. The second one we have actually also has, at the time that it's doing the cold laser, it also has a muscle stim unit in it, which is really effective for if you have muscle spasms, for eliminating those muscle spasms. And in fact, that laser actually detects inflammation under the skin, and as you move it around on the affected area, it actually senses where it needs to be, beeps, and you place it over the area. It determines the amount of inflammation, and it actually determines the dosage of laser itself, and then you just hold it, you use the tool until it tells you to move on to the next area.
Wow. It's I guess really, this is such a good example, although other conversations have also been good examples of how we don't need to take medications to take care of these different injuries or problems that arise in our day-to-day living. And I'm really grateful for this time, and I'm wondering if there's anything else you wanted to say before we end this call.
No, it's good for today.
Okay. Well, great. We're looking forward to next week then.
Yeah, we will talk to you next week.
Okay. Bye.
Goodbye.